Welcome to the Sniff Spotlight Series. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. The Person of the Year award goes to the many healthcare heroes that have been sacrificing day in and day out to help your loved ones recover and come home to you during the thick of this global pandemic. Words cannot describe the gratitude that you so duly deserve. You guys are heroes, and thank you for all that you've done. Welcome to the Sniff Spotlight Series. I'm Yitz Rubin, your host, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. The Person of the Year award belongs to the many healthcare heroes that gave up of themselves to save lives and care for their patients in the thick of this global pandemic. We really appreciate what you've done, and words cannot describe the gratitude that you so duly deserve. Today, I have the privilege of speaking with AvaLynda Casey. She is the owner, alongside with her husband, of AvaLynda Cottage, a 20-bed memory care home for Alzheimer's and dementia in Dixon, Illinois. So, AvaLynda, what made you go into this? Do you have any personal connection to Alzheimer's?
I do, and thank you, Yitz. I think a personal connection would be through my father, who had Alzheimer's. My husband and I did not have any medical background. We're more in real estate and business, and my passion is actually tiny homes and small homes. But we found this business for sale, a memory care home, and because of our experience with our family, and really felt like we wanted to just jump in. And so now we have a 16-bed, 17-bathroom home for Alzheimer's and dementia residents. And it's really where my heart is right now.
Very interesting. So you're more an entrepreneur in real estate, and you came across this business and sort of slipped into that. Is there any special licensing you would need, or any background that you feel might have helped you?
The facility is licensed through the Illinois Department of Public Health. And so there are requirements there for safety and building codes and things like that. We were fortunate to be able to purchase the business that was already operational. And so not having a background in that field helped us a lot. So the staff stayed on, and the policies and procedures continued the same. And we were able to slide right in. And then this year, being our second year, we're implementing more of our vision and more of our goals, and trying to see what was working and wasn't working and is working, and trying to improve on those things.
It seems like this would be a very big need, a smaller community, because sometimes it looks more commercial, some of the larger facilities. What would you say some of the benefits are of coming into a facility like yours over going into a larger facility?
Well, as a home, the maximum capacity is 20 beds. And so we are smaller, our staff is smaller, so there are fewer people coming and going. For example, some facilities might have a cook and a side cook and a prep cook and a kitchen staff cleaning. We have one person coming and going for the dietary, and she cooks, plans the meals, and then we have other cooks that come in and take her place during the week. But that's just one example of a smaller staff and safer for the environment of sanitation. And so we're really happy with the home setting that we have. It looks really like a ranch style home with bedrooms off to the sides, and fireplace and piano and a living room, and the living room and dining room and kitchen are all open to each other. And so it smells like the coffee is percolating, and you can tell what's for supper, and it just sounds like home there.
So this is really a home away from home for some of the people that have been stricken with certain issues, Alzheimer's, dementia. What are some of the benefits that you would say of having this ranch style home?
I think number one is its size, that our residents who are walking around, maybe they're mobile in a wheelchair, they don't go down a long hallway and then get lost. And by it just being close to get to their room, then they feel more familiar, that they're in familiar setting. And the residents actually bring their own furniture, so they recognize some of the time their bedspread and pictures on the wall, and it's really comforting for the family to know that their things are around them, things that remind them of home. And so knowing that and understanding how we're able to do things faster, I think we don't have committees and boards and all that we run through everything with. A lot of time we can just make a snap decision because it's easier as we're smaller.
Yeah, this must be very comforting for the loved ones and family members that are looking for a home to place their parent. And this is like everyone knows each other.
Hmm.
Everyone cares about each other. It sounds like it's a very different feel. Can you describe that a little
Hmm.
bit?
Well, you walk in the door and their walls are not white. They're off tan, and we have pictures on the walls from Kohl's and Target and places where you would have furniture in your home. It's not a commercial level of sofas and chairs. We're lift chairs and recliners, and we have 6 skylights in the living room, so there's a lot of light, which makes a big difference for our dementia residents. And the staff all know each other. We have about 25 employees, and so they work together to cover shifts and help each other when we need it.
Wow. So I heard a little bit the baby doll count is going up at your residence.
Yes,
Tell
yes.
me more about the baby dolls providing comfort while communicating with your staff.
Hmm. Hmm. Well, the dementia resident sometimes feels lost, sometimes feels confused, and to just have something we've found that they can just hold is very beneficial for them. And baby dolls for women, of course, brings back that nurturing, mothering feeling and comfort and calm.
What about live pets, cat, dogs?
Hmm. Hmm. We can bring them in. They don't live in the home right now, but there's no problem doing that. There's regulations that allow that. Cats, not so much, because so many people are allergic to cats, even staff, but dogs and other animals are welcome. We're limited right now because we're not able to have visitors in the home for that, but we are allowing family members coming in a designated area.
So I hear you tried to retool a nursing home. Tell me
Hmm.
a little bit why that didn't work out.
Well, it was an empty building, and once the transition happens, then that's the perfect opportunity for state agencies to say, oh, it's time to upgrade. And so there was a lot of upgrading that needed to be done. And when you're looking at a facility that maybe has been operation for 20, 30, 40 years, and it was built 50 years ago, there's a lot of structural or just the mechanics of everything that needs to be upgraded. And it just wasn't feasible for us to do that. And with our background in um, real estate, I have more of a passion for the residential side. So I was looking for smaller. I didn't want 80 beds. I was trying to figure out how to make 80 beds feel like a home. And I just couldn't do it. I was thinking paint color and furniture and carpet, and it wasn't enough. So what we discovered was just start smaller. And that, I think that was the key.
So it seems like you're a businesswoman. You guys have ambitions and a business sense and a business model. Is this sort of like a test to say, hey, let's make this work, figure out an operations to operate a smaller facility and then create more or buy more of the smaller facilities? Or is this like, hey, this is a stepping stone to say, hey, we learned how to operate this, let's buy a larger facility?
Well, I would love to say yes, when we can get this one working, we'll buy another one. I would be excited to do that. And so once we have this one running, the need is there. And being involved in just less than a year and a half, we are still in the marketing, getting our name out there, wanting to develop a waiting list, and making sure that our staffing needs are met. And so we're still getting off the ground. And so looking forward to more opportunities. I don't know what is in front of us, but we're getting there, getting ready.
Right. So do you feel like this is an opportunity, that this is something missing in the market, that currently most facilities are larger and, some people may not feel so comfortable sending them to a nursing home and they'd prefer sending them to a more homey feel, not like such a hospital setting.
Mhm.
Is that like a niche you're seeing in the market?
Well, I think it's something that every family would like to see. We are unique in that we are private pay, which means that we do not bill to Medicaid. And so that limits the number of residents according to how they have saved, what their finances look like. And so what we find is that our residents come to us when they have that 401k or that retirement savings or a home to sell or other funds in a trust. And if the money lasts longer than they do, then they stay with us until the end. And that's what we like to see. And those are our clients. For people who know that their loved one is still remembering some of the time, but they just are having 24/7 care needs, people will move their loved ones in even as temporary as a year or two, just because they recognize that while their loved one is now in this degree of cognitive function, they are going to get worse. And we would like them to be in a home where they can get best care, have activities that are planned, things that are best for them for now.
And what would you say that percentage of, the 25% have cognitive issues? What would you say of that percentage would have that 401k available and the funds available?
I think our number is right at about 30%. And just depending on where they are in their decline and the desires of their family. Being in the Midwest, the population isn't huge out here. And so even the numbers for our marketing, we do market an hour around. And so all the way to Iowa and all the way to Aurora. And it just depends on what the families are looking for. And our pricing is comparable in our area and very affordable for the services that we provide.
So I hear you have no cases of COVID. What do you think you guys are doing differently?
Well, I think all of us are thankful to God and pray every day for his protection. We have had a lot
Amen. Should
of
we do a prayer together?
we have a lot of I guess exposures to COVID, and we've been tested several times just to make sure. That's a part of regulations in our area. But beyond that, we as a staff still are sanitizing every shift and making sure that we're using good hand washing. All the staff wears masks 24/7 during care. And I think it's just because we have probably less people coming and going that has made a difference.
So talk to me about how you work with residents, families, and power of attorneys to really help make their days better and more positive.
Mm-hmm. Well, it's easy to take a tour and to have your doctor fill out the paperwork that allows us to care for their loved one. We have our nursing director make an assessment that will show, yes, they do have cognitive decline and they would benefit from 24/7 care. And then at that time, then the power of attorney can help and coordinate with our medical director to make the plan of care. And so from the beginning, our communication is very important to our staff with the family, because we want to make sure that we're doing everything we can that makes that resident's home a good stay, sometimes developing new memories where there are no memories left, even just for 5 minutes, making that a good moment for them.
AvaLynda, thank you so much for sharing this tremendously important part of senior care for an incredibly vulnerable part of the population. The SNF Spotlight Series highlights all healthcare heroes and thought leaders in the SNF community, so stay tuned.
Thank you.
Thank you for sharing this tremendously important part of senior care. The SNF Spotlight Series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.